condition will suffer, our bodies will frail, and our minds will frail, but there is treatment. So I wouldn't let stigma stop us from getting the help that we need and is out there.
Okay, thank you. Dr. Lewis, there are a lot of myths out there in the community about the virus and about the vaccine. I've heard members tell me, it was manufactured too fast. What's in it? People have died after they received it. Can you address some of those myths and concerns?
I think he's talking Dr. Lewis.
Yes.
Well, oh yeah, I'm sorry, Dr. Lewis.
Yes. I'd be happy to answer that.
Okay.
One of the things that we do in the faith-based community is that we have faith and belief in God. And we have faith and belief that God will protect us and keep us. But God has given us medical science. He's given us doctors. He's given us pastors. He's given us all sorts of guides along the way to assist in this journey. And he expects us to utilize that. The fact that the virus came out quicker and the vaccine came out quicker than any other vaccine, this technology has advanced. We broke the genetic code, so we can do things differently than we did in the past. And yes, it is quick, it is fast, but it does work. And because it works, we need to utilize it. Faith in God does not prohibit us from utilizing modern science. And in fact, I think God expects us to use. He says, where there's no vision, the people perish. And I think what he's trying to tell us is that, yes, we pray, we listen to him. God should be our guide. And a lot of times we use the excuse that, well, I'm going to put my faith and trust in God, and I'm not going to deal with this man-made thing. We say that very glibly, but God wants us to take that relationship with him very seriously. And if we take that relationship seriously, he will guide us. And I went and got the vaccine. My wife has gotten the vaccine. And I would urge everyone to get the vaccine because it's life-saving. It's better than dying. And you won't know that until you're in the throes of it. And I've had too many people look at me with dying eyes and say they wish they had listened. They wish they would have taken the time to follow the recommendations. But when it hits you home, I'm telling you, there's no backing out. Prevention is the name of the game, and the vaccine is a way of preventing this disease.
Yes, the calls I get as a pastor, the members are already in panic mode because they are afraid of what could potentially happen because they're now infected. And so now we're in prayer mode and counseling mode and concern because I know for us, infections lead to death. And as a result of death, traumatic experiences, and unresolved grief, and just long-term trauma that we continue to experience. Can you help the audience tonight, with some sense about how you make that decision to take the vaccine?
Well, here's what you do, and again, I am faith-based, I pray. And if you really have a close relationship with God, he will guide you, okay? And he's guided me and my family to be cautious and to do all the preventive things, but also to be wise. And I think if you listen to the data and you listen to the information out there, it's the best that we have right now. Now, is it perfect? No, it's not perfect. Could bad people do things that could mess it up? Probably. But that's where your faith comes in. Your faith comes in is that you trust God to handle the things that you cannot handle. God expects you to do what he's given you information to do, but he will handle the other. And you have to relax and be confident in the fact that you have put your faith and trust in God and that he will guide you and protect you. You do the vaccine, that's what you can do. It's God's job to take out all the unknowns that you don't know about. And he has done that for me over the years. I shouldn't be here. I've been so exposed before we knew about this virus, the number of patients that I was exposed to, including some of the early deaths in Pasadena. I should be ill. Some of my colleagues contracted it. And I had to talk with one of them that was on the ventilator for over 3 weeks. And he said it was the worst thing that he's ever gone through. So listen to the information that's out there from the leaders that you trust, and let God take up the rest.
Okay. All right. Do you have some additional data you'd like to share tonight?
Well, I think regarding this virus and regarding your loved ones, this gives us a time of pause. And Dr. Walton really made that clear. This is a time to come together as families. You know, every time we have something that happens in life, it's God's way of saying, listen, I am your all in all. I need you to talk to me, and I need you to allow me to give you peace. And so this is a time to hug your loved ones, to stop the bickering, and to come together in love. We only have one enemy in this world, and that's Satan. Everybody else is someone to be loved and someone to be helped along the way. And our job is to do that. And so with this information that we're giving you, we want to save your life. We want to save your family's life. And I think every American who is able to, whatever age group you're in, when the time comes around for you to get it, call up your local health department, your local county. They have it now in the clinics. They have it in the Walgreens, CVS. Any opportunity that you can get the vaccine, get it.
Okay. What are some questions a family member should be prepared or know to ask their doctor if they have a loved one who's infected or who's in the hospital?
Well, I think if you have someone that's infected, most of the time when I see people who are infected, they've already exposed everyone in the family. Okay. And usually about 2 weeks after the infection, even though you still may test positive, you usually are not contagious in terms of being able to cause an infection in someone else. And so if family members have been infected, there is no need to panic. If you're not having symptoms, stay home and isolate. And if you are having symptoms, contact your physician early. There are some things now that we do have available that has shown some promise in early detection before you develop the respiratory symptoms. So contact your doctor and ask them about early treatment if you become symptomatic. And there are other symptoms besides respiratory. You can get the loss of taste and smell. You can get diarrhea. You can get loose stools. You can get headaches. You can actually get a troubling in your thinking where you don't think straight. Any of those signs that you see, you want to get treatment early. If you get treated early, you're less likely to go on to develop respiratory failure and be on the ventilator.
Okay. We have a question. How does faith in God reconcile with taking the vaccine?
Well, that's, go ahead. You want to go ahead and touch on that one, Dr. Walton?
As a scientist and woman of faith, I think we're always constantly making sure that we have God first. But you talked a lot about godly wisdom. I believe he directs and guides. I believe he gives us knowledge and discernment when you have that relationship with him. And, we vaccinate our children and they're safe and better. We now have an opportunity to have what the majority culture has. For many years, we're left in the dark or we're the last to know. We now have opportunity, equal opportunity based upon age or based upon medical condition and so I think it's our time to embrace the fact that we finally have the same opportunity to get it. Because I think that's going to be our only way out of this, is to really have people protected so we can protect one another and get back to living our lives. But you talk about faith, it's about discernment and really listening to those people that you trust. I'm a physician, I'm a scientist, I'm a woman of color, and I'm a child of God. And I took the vaccine and I've taken my second vaccine. I'm 3 weeks out and I'm now rounding in our emergency department to help with the emotional needs of our first responders. So I'm living it as I'm saying it. And you want to look at people who live their faith. These physicians here are living their faith.
Yes, and I'm a pastor and I'm a man of faith, and I've taken the first dose and I'm going back on the 15th for the second dose. And this time I'll remember to have my camera to take a picture so I can use it to show people that I'm serious about what we're doing on tonight. Dr. Lisk, I think you want to talk about the specifics of the vaccine.
Yeah, so there's a lot of people, especially in our community, people of color, that are suspicious of the vaccine. Are they putting something in it? There's other kind of little conspiracy theories on this as well. And so I just want you, and I'll be honest, when the vaccine first came out, I had that same reaction. I looked over to my wife and I said, well, I'm not going to go get the vaccine right away. I'm going to wait till a lot of other people get it. And then when I start, even as a physician, I had that first impulse, knee jerk. But then as I started to look at how serious the disease was and look at the data, I knew that is not the right decision. And you start seeing the number of deaths and serious hospitalizations, how people that don't believe the vaccine, don't believe COVID was real, thought it was a hoax, they get in the hospital and they'll tell you, I'm going to be okay. I'm going to be okay. And as Dr. Lewis said, their breathing just gets worse and worse and worse. And they don't believe that virus is real until they're in ICU and they're almost knocking on death's door. And so what I want to talk to, my brothers and sisters out there in the community is, when you see that many of these were Republicans, of course, but when you see these people that were doubting and calling it a hoax, and then when the vaccine came out, these same people, these same politicians were first in line to get the vaccine. Okay. They were first in line to get the vaccine. All of them have got it. Even the people that were saying that COVID wasn't real. Okay. So that's one of the first things I want you to think about. All right. So the other thing is that we talk about, okay, well, vaccines usually take 3 to 5 years to get done. Well, remember, in Europe, things happen much faster. They're 10 years ahead of us. In America, there is a lot of red tape with the FDA and things move much slower here. Now, when I had interviewed with Biogen once and I looked at I saw the drugs that they were, researching, they probably had about 10 drugs for dementia and Parkinson's alone. Not to mention they're maybe in a pulmonary field, they may be in a rheumatology field. So you could have these pharmaceutical companies focusing on 30, 40 different molecules or drugs all at one time. Now you look at Johnson & Johnson, Pfizer, and Moderna, that whole company is laser focused on one vaccine. That alone makes this vaccine, cuts the time down dramatically. And then, of course, the FDA cut through red tape. So normally what would take 2 or 3 years, they approved it for emergency use. Okay. So we have to think about that too, that this is not the conditions of this pandemic has really accelerated the process to get a lot of barriers out the way so we can get this thing done fast. Now, when you get the first shot for Moderna and Pfizer, you're going to be about 80% protected on the first shot. And then the second shot brings you to 94% with Moderna and 95% with Pfizer. But remember, even though Johnson & Johnson, that vaccine is only 66%, that is really, really significant because it is about 80+% in preventing severe illness. So not only do you not want to die from it, you don't want to get severely ill because people are having complications from COVID too that may last with them forever. Okay. So that's another thing we want to think about. And, getting the vaccine is just, so important that I really want to stress that because it's saving lives and we are the ones that are dying the most from this vaccine.
Thank you. Questions I've been asked today to ask you guys tonight. Should you take the vaccine after you've had the virus?
Yes. I just had a patient today call me and said, you know what? I was positive for the virus, and I went and got my vaccine today. And so I asked him, well, how are you feeling? Because normally we recommend that if you have had the virus, that you should wait about 90 days. And the reason for that is that once you are exposed to the virus, you do develop some immunity. But the studies have shown that that immunity may not be well enough to prevent further disease. And so the stimulation that it does to your immune system is not as good as the vaccine. The vaccine, because it's 2 doses, it's kind of like a stair step. You get the initial dose, you develop some antibodies, and before that antibody level begins to fall, you get that booster level, which then boosts you up to a level that allows you to be protected at least through a season. And again, whether we have to give another COVID vaccine every year like we do with the flu, we don't know yet, or what's going to come of that. But right now, in order for us to get this disease under control and to limit the spread, everyone needs to get vaccinated they can.
Okay. Another person today asked me to ask the panel on tonight, what if you have severe allergies? Should you take the vaccine?
I think you should be cautious. In fact, those are the only people that we've seen some reactions. But even in those reactions, I don't believe to date that we've seen any deaths from that. And so, yes, if you're a person who seems to be allergic to everything, a person who carries around an EpiPen because you're allergic to peanuts, you're allergic to bee stings, you're allergic to everything, I would probably be a little cautious about it, getting the vaccine. But I would have that discussion with my physician and have them go over the pros and cons and make a decision based on that. But I would not make it an absolute no. I think it should be discussed, and there may be some reason or rationale while you may have a reaction that it still may be worthy that you still get vaccinated. So you should have that discussion with your physician along with your allergist to find out what's right for you.
Mm-hmm.
Can either of you speak to the reaction you may experience after receiving the first dose or the second dose, and what's happening internally with your body?
I'll be happy to tell my experience. I'm a very optimistic person, and to me, nothing bothers me. I'm not afraid of needles and anything. So I went in, with all the anticipation that I'm not going to have a problem, right? So I go in, and within probably the first 3 or 4 hours, I began to feel a little soreness. I didn't even feel the injection, to be honest with you. I happened to be busy on my cell phone at the time that I was getting my injection. I didn't feel anything. But about 3 or 4 hours, I began to feel a little swelling. And the swelling continued for about 24 to 48 hours, and then it began to go down. Probably about 72 hours. Now, this is on the backdrop of me being tired, because I think that particular night was in December when we had the surge. So I was probably getting anywhere from 3 to 5 hours of sleep. And I believe on that third day, I sat down at the computer to do something. And it took me a moment to ask myself, okay, what were you planning to do? How are you going to do this? How are you going to put the order in? And that lasted for about maybe an hour. I got a little bit of sleep. And when I woke up, I was fine. Others of my colleagues have mentioned a mild headache, a little stiffness in their neck. Some have had some other, variable symptoms, but I don't know of anyone who's had symptoms beyond 3 or 4 days.
Okay. I'm sorry, go ahead.
I had a similar experience. I had some injection site tenderness. I had a wonderful LVN who gave me the shot, and I didn't even feel it. In about 72 hours, I also felt a little brain fog and fatigue that passed. But if I hadn't known to look for the symptoms, I wouldn't know. But about 25% of my staff had a little bit of a headache, some more fatigue, and a little nausea. Once again, 3 days, and they all were able to work that same week.
Okay.
So, and also for me, when I got my first shot, it's a small needle. I think it's like a 27 gauge needle. So when she, I think I was looking someplace else, and I asked her, I said, "Did you stick me yet?" And I looked over, and the needle was already in. And so because I'm allergic to penicillin, okay. So for me, they said, well, we have to watch you for half an hour. If people didn't have any drug allergies, they were watching them for about 15 minutes there on site. So there is a little time that they'll observe you. My wife had a real red area, and both of our arms were about sore for about, my arm was sore for about, moderately sore for about 3 days. I think her arm was sore for at least a week. We didn't have any headache, flu-like symptoms. I know a friend of mine, his wife is a lawyer. She got the shot, and many people are reporting flu-like symptoms on the second shot as well, but less of an injection site reaction. But some people are reporting that. Also, if I can, I want to talk a little bit about taking the vaccine, the timing of taking the vaccine, the variants. As Dr. Lewis said, you get some immunity, and that range is about 30 to 90 days. But we don't, some people may go to 90 days, some people may go to 60 days. You're not really sure, but that's the range. And so if I've heard some people say, well, I'm going to wait till 3 months to get the vaccine. And so when you get the first shot for Pfizer, Moderna, you think you have to wait I know Moderna, you have to wait 28 days. So that's 1 month, right? So you're at 80%. Then you get the next one after 1 month, you're at 94%, but then you're not immune for 2 weeks after that second shot. So we're really looking at 6 weeks. So if you do wait to 3 months exactly, then you're not really fully immune for another 6 weeks after that 3 months. And so that's something you have to consider too. So if you had COVID, for me, and what I'm recommending for people to do is about 1 month after you have COVID, just go ahead and get the vaccine at that time. Because even though you may have antibodies, it's not going to hurt you to do it. And you don't want a gap between when your antibodies in, which you don't know if it's going to be in that 60 or 90 day window, and also when you're getting that full immunity. But remember,
can you talk about antibodies for those who are listening, so they understand?
So your immune system has basically little molecules that will attack foreign proteins in your body. So if you inject something in your body and the body doesn't recognize it, because everything in your body has basically little signs on them, which are proteins. These little signs are proteins that are specific for your body, and your body recognizes these. If your body sees like a bacteria or a virus, it will attack it, okay? And this is what happens with autoimmune diseases, of course. And so when you're exposed to a bacteria vaccine, your body will develop antibodies to that. And these vaccines help you build that immunity. Now, when we talk about the vaccine and variants, the Brazilian variant, the South American variant, if you're infected with COVID, these variants, you're not going to be protected against these variants. That's one thing that they're saying. They're not very certain at all that you're going to be protected by these variants. But they believe, and they're not sure, but they believe that the vaccines may provide some protection against some of these variants. Okay, but what's happening now is like Canada has enough vaccine to vaccinate every person 5 times, and many of these countries are building up stockpiles of these vaccines. And what's happening with the third world countries is that they are unable to get sufficient quantities to vaccinate their population. So an article I was reading said that countries like India, Africa, they may not be able to, in Brazil, they may not be able to vaccinate their population fully until 2024, which then creates more variants as this virus is allowed to mutate outside the United States. And so there is a concern that as the virus mutates, it may become more virulent, which means it may cause more severe disease, may have the ability to cause more death. And so there might be a race to develop more vaccines, and you will get some protection from these vaccines from that variant, those variants. Even if it's 50% or 60%, that is very good. So you need to get this vaccine, and there'll probably be more vaccines to come because there's about 600 being studied right now.
Okay. If a person has sickle cell, Graves' disease, should they take the vaccine?
Absolutely. People who have chronic diseases are also immunocompromised, and the immunocompromisation makes you at risk of having a worse outcome if you actually get the virus. So you really want to get vaccinated. And again, if you have a specific concern regarding that particular illness, because Graves' disease is an autoimmune thyroiditis, and you can talk it over with your physician and lay out a plan that will work for you. But all of the diseases, whether you have rheumatoid arthritis, whether you have polymyositis, and we can go down the list of chronic illnesses, they put you at risk of having a worse outcome from this disease. Mm-hmm. And so you just don't want to go there. You want to get vaccinated and get protected.
Okay. I was reading a study on, Dr. Walton, did you want to say something?
I was going to say the only folks that we aren't vaccinating right now are 16 and below because they weren't included in the study. So they're beginning now to do some clinical trials with younger people. Okay. But over that age, and even pregnant women now are getting the vaccine as well. So it's really those folks who have had allergic reactions specifically to vaccines in the past, where they want to talk it over with their professional and make sure that they have precautions. But it doesn't mean that they're contraindicated. I have known several people with lots of allergies to take this vaccine and not have a problem. So talk it over with your healthcare professional.
Yeah, definitely do not be scared if you have chronic conditions, chronic neurological conditions like Parkinson's disease. Even more so, you should go out and get vaccinated. Any chronic disease that affects the respiratory or cardiovascular system, you need to be first in line. If you have blood pressure, you're taking blood pressure medication, you're taking cholesterol medication, you go see a cardiologist. Well, that means that you have a cardiology problem and you need to go get vaccinated. And as we have said, allergies should not prohibit you from getting the vaccine. I have probably one of the worst allergies you can have, penicillin allergy. And there's other people that have had sulfa allergies, and I had one lady that had 6 allergies. She got the vaccine and she didn't feel a thing. She had no side effects but a little soreness. Hers went away before mine. Okay, so I think it's really important that we dispel these myths and get out there and get treated, because we are number one on the death list for COVID.
Yes. I was reading some data last night, and hopefully you can speak to this, of young adults, 20 to mid 40s, of being super spreaders of the virus.
Yeah.
One of the huge things that happens with this virus is that everyone who is exposed or come down with the virus are not ill. And what ends up happening, and I see this over and over again, a healthcare worker or somebody on the front lines in public service, whether police, firemen, paramedic, they may get exposed to it and they go home. They don't have any symptoms, but then the whole household, particularly the elderly, get sick and die. And that's unfortunate. So you don't always have symptoms. And that's why the mask is so important. If one of your family members has an occupation that takes them away from their home and exposes them to different things, they absolutely need to have the mask on while they're out, but they probably should have the mask on when they come back home, because the risk is great. And if you've been out and you don't know who, and that's why these super spreader events, no one knows. Every one of these super spreader events, we have people who don't know. I had a gentleman who asked his father to come from Pasadena to Orange County because Orange County was open. Father went there for his birthday party and contracted the illness and came back to Pasadena and died, unfortunately. And the young son was just devastated over it, but it's too little too late.
Yes. Yes.
Yeah, the younger people that are younger, and then also people that don't have any pre-existing conditions are more likely to be asymptomatic. And this is the problem with schools, that the kids, school-age kids, middle school, high school, could get COVID and they have no problem at all. They don't even know they had COVID. And then they take it home to their parents or grandma, grandpa, and they give them COVID, and now they're hospitalized. Now, my wife and I, we actually contracted COVID in December, and we both lost our taste and smell. And my wife's smell still hasn't come back. And so it felt like allergies at first. And our medical assistant came down with COVID. And at first I said, well, it's just allergies, and I hadn't changed my air filters in my house. And so about 3 or 4 days, and then when I realized she couldn't smell her perfume, I went to the kitchen and grabbed some cayenne powder and some chili powder, and I put my nose deep in both of them, and I couldn't smell a thing. And that's when I knew I had COVID. But my symptoms were like allergy-like. So even if you're having allergy-like symptoms and you're not sure, you go ahead and try to test your sense of smell. And if you don't have a sense of smell, you can't smell things you normally can, chances are, yes, you probably have come down with COVID.
Okay. In the medical profession or in any place you go, these forms you sign saying that you're giving informed consent. And during this crisis, can you talk about, for me, it's like, how do you sign a form saying you're making an informed consent when you know very little bit about this disease? So can you talk about that?
Sure. Well, the informed consent basically is that we've given you the available information that we have in terms of the risk benefits of this particular modality, which happens to be the vaccine. And we're basically saying, we're telling you, and of course, in the medical community, we always give you death and doom. We're going to tell you, yes, you could have a reaction local, but you could die. Even though we haven't seen it, we usually will give that disclaimer because we don't know how things are going to react with the system. But it is different, and it can flip on you. And so the informed consent, and that these are the potential side effects, and that you agree to take the vaccine knowing that there are some potential adverse reactions that could occur. But the benefits outweigh the risk, and therefore that's what we take. It's always a numbers game. And usually when we tell you the risk of less than 5 or 10%, that's a good number.
Okay.
If they told you the risk were 90%, that would be different.
Okay.
Yes. Hey, I want to add to that too, is that, we know. So first of all, also, they have to give you theoretical risk too. So like Dr. Lewis said, in those studies, no one died from COVID. The COVID vaccine. Okay. But we know the things that we know that are important is that people are being hospitalized. People are leaving. When people leave the hospital, a lot of these people aren't leaving whole. A lot of these people aren't leaving back at their baseline. They're still having, some of these people may have persistent symptoms from the infection. And we're still learning about after effects of COVID, not only the mental after effects, but also the physical. And so, it's just important that we, get everyone vaccinated. We know the important things. We know that it kills you, and we know that it could cause severe illness and hospitalization. And we know that African Americans are the most at risk. Mm-hmm. Those 3 things alone make me want to get the vaccine.
Okay. I have 2 more questions, and then we'll wind this up tonight. Can the vaccine change a person's DNA?
I can take that. No. That's one of the big myths, is that somehow your blueprint is going to be changed. So there's DNA and messenger RNA. And the 2 vaccines that we're using in the US, the Moderna and Pfizer vaccine, are messenger RNA. So basically, It's taking a little bit of a blueprint from that spike protein that really is causing the contagion with the COVID-19 virus, taking a blueprint of that into your messenger RNA so that whenever you take it into your body body sees it as foreign and begins to make antibodies against that. But it's so unstable that as soon as it's injected into your system, it dies. So you don't have live virus. You can't contract the virus. It really is just allowing your system to see it in a safe way to make antibodies. So if it sees it again, it knows to attack. It's messenger RNA, which is a new technology, a couple of years old, about 2 years old, but it's not brand new. They used it with the Ebola virus. So that's my contribution. But I hear that all the time. I'm going to be changed, or people of childbearing age, things are going to change for my child. That's not true. You'll be here to have children. Okay. Really, the vaccine is going to allow you to be here because you really don't. I talked to 3 patients today. One had lost their father. One was on oxygen and their mother was on a ventilator. And one person had lost their father last week. And these were just 3 of my psychiatric patients. The grief, the amount of grief, the collective grief of 400,000+ people dying or having serious illness post this, we are in for a major, major impact going forward if we don't get this controlled. And the best way really is to cut down the spread, have people immune, have people not get sick and go to hospitals, and really contain this so that we can have lives again. It's that simple. It's not political. It's a virus.
My final question is, I've talked to a number of people who were discharged or sent home from the hospital with a, what do you call the thing for asthma?
Inhaler.
And they're struggling with their breathing. And so, when they call me, Pastor, pray for me. And I'm like, how are you feeling? And they say, I got this inhaler, but, I'm struggling with my breathing. I don't, I'm not a doctor, so I'll pray with them. I say, you probably should call your doctor and tell them that you're having trouble breathing, so.
Yeah, unfortunately, I think that, and this is what I was talking about at the onset, where I said the reason that the African American and the Hispanic numbers are so high, it has to do with access and treatment. And a lot of patients are discharged home without clear instructions and without clear education. My recommendation to anyone who has come down with COVID, that you make the purchase of what is called a pulse oximeter. It's a little device that you can put on your finger that will measure the oxygen content in your blood. Your oxygen level should always be above 90%. And if you're having some breathing difficulties and your O2 sat, as we call it, is above 90%, then you can rest assured that you're not having a serious respiratory illness. But a lot of the COVID people who were sent home after 1 day in the hospital or 2 days or after visiting the emergency room, when they go home, their O2 sats have dropped into the 80s, 70s. And a lot of these people are some of the reasons that they don't make it and die in their sleep because their O2 sats were low. And they thought they were okay because when they left the hospital, their numbers were good. And unfortunately, a lot of these people have bounced back. And so I tell my patients and even patients in the hospital that if your O2 sat is not above 90, you need oxygen. Okay. If you're having trouble breathing at home post-COVID initial infection, you probably need oxygen. And don't stay home and try and tough it out. It may be life-threatening if you do.
Okay. In wrapping this up tonight, listen, I've been enlightened and blessed to be in your presence tonight. Can each one of you share a final thought or a final comment that would impact the viewers to cause them to pause and really consider taking the vaccine?
Well, my advice to everyone is that God is real and God protects us and God is watching over us. And that's what I live by. Every decision that I make, I run it by him. He has his hand in it. And I think that what you have to do with this whole vaccine is give it to him. Give him your anxiety, give him your concerns, and then step out on faith. That's where your faith comes in, is that what has been made available is life-saving. Trust me, it is life-saving. And so if you step out on faith, he will make up the rest. And my last parting words is in the prophet, as the prophet John said, I wish above all that you would prosper and be in health.
Mm-hmm.
God bless.
Yes.
That's great.
Well, one thing that I want to piggyback on what Dr. Lewis said earlier, the pulse ox is very good, and I was just looking up the price of it. I bought one, but you can get one for $19.95 right on Amazon, $21.95. So these are not very expensive, and they could really signal you that you may need to get to the hospital or ER. So the last thing I want to impart on people is that when you're taking the COVID vaccine, if you're worried about the level of protection, know that the Pfizer's 94%, or the Pfizer's 95%, the Moderna's is 94%, and the Johnson & Johnson gets you 66%. However, don't not take the Johnson & Johnson if that is available to you, okay? If that's, if the other two vaccines are not available to you, get the Johnson & Johnson, because you're getting 66%. Then you're wearing masks, which is then increasing your protection there. You're washing your hands, you're doing social distancing, you're constantly increasing your percentage of not getting the vaccine, of not getting COVID. Another thing is do's and don'ts for masks. Do not wear the mask with the little ventilator vents on there, because that's where the virus could get in and out. Wear the mask over your nose, okay? So you see people all the time wearing the mask below their nose. Well, the virus could get through your nose as well, okay? These putting a t-shirt or handkerchief or bandana, anything that's a single layer is not going to protect you, okay? So don't use those as masks. Anything used as a mask has to be a double layer, okay? And you could also utilize face shields, but I've seen some people with face shields and no mask. That's not going to work. If you have a face shield, you need to have a mask on too.
Dr. Walton.
Yes, I agree with both of them. Faith above all, and then trust that God has put people on earth to understand the science, and we now have the opportunity to blend our faith and our science. And when you're given the opportunity, pray about it, do what's best for you. But we're all African-American physicians who have had to consider this for ourselves, who made a decision based upon what we see every day and what I hear every day. And I wouldn't want one person to suffer needlessly if they have the opportunity to protect themselves and their families. So just consider if not just for you, but for your family, and so that we can go back to being in communion with one another. I for one, I miss church. It's wonderful on Zoom, but I miss being around people. So this will allow us to get back to what we know in fellowship. So that's what I would share.
Yes. On behalf of the Bethel Church, I want to thank Dr. Lauren Walton, Dr. Nathan L. Lewis, and Dr. Jerome Lisk tonight for giving us your time and your professional expertise. I look forward to some more conversations with all three of you. Thank you for your time tonight. And to the audience, I hope you've been blessed and grateful tonight for this panel who shared with us their expertise. And so until next week, stay in the blessed place.
All right. Thank you for having me.
Thank you.
Thank you.
Thanks for joining our Wednesday night virtual service here at Bethel Baptist Church of Pasadena, California. Again, visit our website for giving information and more. It's bethelpasadena.org. On behalf of Pastor John T. McCall, thanks for watching. If you're ever in the Pasadena-San Gabriel Valley area, we invite you to come in and visit with us at 1972 North Fair Oaks, Pasadena, California. To order a copy of today's message or for more information, log on to bethelpasadena.org or call the church office at 626-794-3136.